Hello ladies and gentlemen, and welcome to another edition of Workout Wednesday. We're talking about patella tendonitis this week. On Monday we talked about some manual interventions and some self-treatment techniques that you can do at home. So what we're going to talk about today is some exercise interventions and a progression in which you could use to treat patella tendonitis or anterior knee pain. So today we have our subject Justin here, who's going to demonstrate our progression. So what we'll do is start with one of the most important foundational movements that we want to be able to accomplish in order to ensure that we're okay to move on to the next step is just a simple straight leg raise. So what we'll do is we'll flip-flop these legs, and what we want to see is a perfectly straight leg that as he's at rest, that knee can settle down to its straightest position. What he's going to do is he's going to pull the toe up into full dorsiflexion, which puts the back, it stabilizes the back of the knee here. And then he's going to raise that about maybe 10 inches. And then he's going to come all the way down to the mat, and he's going to turn off and unload. He's going to re-engage, boom, controlled, and down, and off, right? So if you watch the kneecap, it goes up and stabilizes, the quad turns on nicely. He's going to control lift, no extension lag whatsoever, and relax. Now if you find when you're relaxing, if that knee really settles down a lot farther, that means you have extension lag. That means that you have a little bit of instability and weakness there, so we don't want to move past this step until you can complete 10 straight leg raises with zero extension lag whatsoever. And that tells us that you're qualified to progress into the next phase of a patella tendon rehab, right? So let's move on to the next step. All right, so the next step in the progression is going to be positional isometrics. So what we want to do is gain the ability to hold a position for an extended period of time and to be confident and strong, not just in the knee, but in the hip, in order to sustain that load over, let's say, a 15-second period. So we're going to start with a low angle, maybe about 30 degrees, and then we're going to progress it to about 45 degrees, and then we'll progress it to a full 90-degree bend at the knee. And what he's going to do here is Justin's going to use the TRX bands for trunk support. So we're not overloading at this stage. We're more focused on position. So we want the knee directly over the ankle here. So he's just going to put about 30 degrees of bend. Go ahead and switch sides so you can get that angle. There you go. And then he's just going to slowly lift this back foot, and he's trying to sustain this position where everything stays perfectly in place, and he's holding for time here. He's breathing, his core is stable. 10, 9, 8, 7, 6, 5. There's a nice load through there. He's just holding it nice and stable. There's no collapsing. The knee's directly over the ankle, and relax. Good. All right. And the next step, now luckily Justin's not suffering patella tendonitis, so we can move along pretty quickly here. But the next step is going to be intermediate, so it would be about 45 degrees. So he's going to step back here. He's going to load that thing just a little lower right there. See how the knee's directly over the ankle. We don't want that knee sliding forward. That's a part of the pathology here. It's habits in which the knee gets really used to sliding too far anterior, which loads the patella tendon. What he's doing here is he's loading his glutes, and the quadricep can then take a secondary action instead of a primary action. We don't want quad dominance, we want glute dominance. He's feeling the pressure more through his heel, and relax. Good, good. And for the last one, what we're going to do is just have Justin take a knee. So he's just going to take a knee on the foam. Good. He's still got support on the TRX, right? This is supporting his trunk angle. We want 90-degree angles everywhere. 90 degrees, 90 degrees, 90 degrees from the trunk and the hip. In the back foot, 90 degrees. The back knees, 90 degrees. The shoulders at 90 degrees. Everything looks great. He's going to do a 1-inch lunge. So he's only going to lift that knee 1 inch off the table, off the pad there. 1 inch. Boom. Good. And he's going to hold that position. 1-inch lift. Hold that position. Hold that position. He's fully loaded and engaged here. Everything is on and stable. And he's just holding for time. He's going to do 10, 9, 8, 7, 6, 5, 4, 3, 2, relax. Good. And he makes it look easy. He's a great athlete. All right, on to step 3. All right, so for phase 3, what we're going to focus on is, again, eccentric loading. So what we want to do is focus on the elongating portion of the movement that we're going to do here. So he's going to actually step up the stair with his non-affected leg or his non-painful leg, and then he's going to control the lowering portion with his painful side that we're actually treating. So Justin's going to demonstrate here. So this is the affected side, the right side is the unaffected side, or the not painful side. So he's going to step up with the right side, he's going to place that left foot, and then he's going to step off and load the left affected side, right? Perfect. And step down, he's going to step up with the non-painful side, and he's going to step down, keeping everything stable and controlled. You see the knee, there's no movement whatsoever. It's not sliding backwards, it's not sliding forwards or side to side. Up with the good, and down, controlling and loading that eccentrically. And this is something that people could do at home, anywhere that you have steps. And I recommend that you have some kind of banister or something that, if you notice that he's got to control his trunk position, which is allowing him to isolate and really focus on influencing that knee more specifically instead of his trunk bending and getting involved in this action. One more time. Loading, and perfect. All right, and now we'll give you a supplement for if you're in more of a gym setting or a PT clinic setting. All right, so for our third phase, what we want to focus on is eccentric loading. So we want to actually get the tendon and the muscle used to elongating and controlling that elongating load. What it does is it causes your body adapts by anchoring that tendon insertion down stronger and remodeling the fibers in the tendon to make them oriented in a more parallel fashion, and actually thickens and anchors down that tendon and makes it stronger. So come check it out. So we're not focused on the concentric or the shortening action, we're focused on the eccentric loading and that elongating action. So with the quadriceps, so he's going to go ahead and push himself to a straight position there. Good. And so what he's going to do is say, this is the affected knee that he's having problems with on this side, okay? So what he's going to do is he's going to push himself up with both legs, then he's going to pick this foot up, and now he's going to load down through the heel, all the way down, all the way down, all the way down. And then he's going to push up with both legs. So we're only focused on the eccentric. So concentrically, we want help. Good. Now he's going to pick up the right side, and he's going to load, and he's tracking this knee right in line with the foot. Everything's nice and stable all the way down. The pressure is dominant to the heel, 60% to the heel, 40% to the forefoot. But we really want a flat surface there, and we want to make sure that knee's not collapsing inwards at all. We want that knee to track outwards and in line with the foot. All the way down, all the way down. Controlled, 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 controlled. Perfect. All right, well, thank you so much for joining me and my guy Justin. This is Justin Holt. He is a PT in training. He's got one more year left, and you'll be seeing him a lot around NeoLife Physical Therapy. Thank you for joining us at Workout Wednesday, and we'll see you next time.